Coming up, I'm delighted to welcome the Transport Secretary Grant Shapps to the show. Good morning to you.
Morning, Julia.
Well, so you've been tasked with trying to appease probably a pretty angry, miserable, depressed nation today after the announcements from the Prime Minister yesterday. This rule of six, the threat of a 10 p.m. curfew. We've seen what's happened in Belgium. COVID marshals with their little clipboards and their high-vis vests. Restrictions possibly lasting until March, and Christmas, realistically, for most families, being cancelled. Are all of these restrictions actually justified for a virus that we are now very much more in control of, which largely kills the very elderly and the very ill and leaves virtually everyone else unscathed? Is it really justifiable to impose these restrictions on people living in a free democracy for that virus?
Yeah, look, we've been down this route before, haven't we? We know how this works. If we do nothing right now, we know that the virus will double in a couple of weeks, and then it turns into a week and then into 3 days. And we know that that's the trajectory of this virus. And we know that because we've been through it before. But actually, we're also seeing the numbers increase elsewhere. And, a month or two ago, when we saw the numbers start to increase in Spain and then in France, we could have had the same conversation. And what we're seeing in Spain, for example, is that the number of deaths is now starting to move upwards as well. So I don't think the facts or the epidemiology of the disease has changed one iota. And unfortunately, unless we take action, then there'd be far worse action required, which we had before. We're not going into a second lockdown, and we're not, by the way, introducing 10 p.m. curfews either.
10 p.m. curfews the Chris Whitty, the chief medical officer, was pointing to what happened in Belgium and how they were able to flatten their curve. Yeah, but they did that by introducing, among other measures, 10 p.m. curfews, and we're talking about 10 p.m. curfews in areas with high rates. I would not be so certain. Are you telling me categorically right now there will be no 10 p.m. curfews nationwide across this nation in the next coming few months?
As you know, we've been in a complete lockdown before now, so I can't promise you
exactly.
anything.
So we can't promise that's not happening. Okay,
we do want to localise it this time, Julia, okay. as you pointed out.
Except we're not localising it, are we? Because this rule of six is applying across the board. Now, you said, look, if we do nothing, but we're not going to do nothing. The Imperial College computer models, which have proven to be really quite inaccurate now, we've got much more information about the virus. 250,000 people would die. That's why we had to go into lockdown. Again, that was if we did nothing. Other countries, have had worse or better rates of deaths on this coronavirus, but everyone has done something. Even Sweden, famously not having a lockdown, they have actually had a lot of people social distancing. If we carried on with the hand hygiene, the social distancing, if perhaps the bars and the restaurants where these young people who were getting the virus were mixing were better policed, that would be probably enough to curtail this, because we do know more about the virus and we do know who dies from the virus and we do know who's most at risk. Would it not make more sense, instead of putting restrictions on the entire nation, to police the rules that are currently in place in public places, like with young people out partying, but also to perhaps offer more shielding to the elderly, to the vulnerable, and then say to everyone else, frankly, you're going to have to take your chances. This virus isn't a big risk to you. You may catch it, you may die, but life is not without risk. And there are more bigger risks if we do actually effectively go into some semblance of lockdown. Shouldn't the government be a bit more grown up and treat us as the grown-ups we are, and allow us to assess our own level of risk as otherwise healthy, normal people of working age?
I'm all up for people assessing their own level of risk. Though this is not something where you go skydiving and there's a level of risk to you. This is something where that risk transfers to other people, your loved ones, or possibly people you've never met, quite likely people you've never met, who then get ill themselves, and some of those people will die. We know that 41,000 people have died. So it's not something which is only a matter of personal choice. But I do agree with you when you said, shouldn't we just sort of clarify the rules and and police it better? One of the complications we had is obviously the initial lockdown was pretty straightforward. You stayed at home. There were only 4 reasons why you could leave at home. We then get into the period that we've been going through where life's starting to get back to normal. But some of the rules have become quite, I think, complicated and confusing. And, for example, 2 households only. You could have 6 people from different households outside, but if you went into a restaurant, for example, that could only be 2 households. How many people knew that? How many people were going in? So it had become, I think, too much of a patchwork. The rule of 6 is very straightforward, isn't it? You know that if there's more than 6 people in a social setting, in home, outside a home, in a pub, in a restaurant, you've got it wrong, and that will make it much easier to enforce. And one of the things the enforcement agencies, the police, were saying is, look, actually, people just need a simple rule that they can follow. It will be the law. Simple to follow. Okay. And I think if we do that, then we can get these rates down again.
Well, it's simple to follow. Otherwise, but will it actually save lives? So I'm in a situation. I've got a husband and a daughter at home. We want to meet up with a couple of friends of ours who've got 2 kids. Kids are at the same school. We're real friends. We've seen each other throughout. That'd be 7 of us. Now, that we would be committing on Saturday. We're allowed to do it. On Monday, we're committing a criminal offence, and all the adults could be fined £100 if we refuse to disperse. If the police decide to knock on the door. However, I could on Monday meet up with 5 other people from 5 separate households, and that wouldn't be an offence. Now, which do you think is a bigger risk of spreading the virus? Me meeting up with one other family, which involves 7 people, or me meeting up with 5 other separate households? I mean, you know the answer to that. It's insane.
Well, as you can imagine, we had pretty extensive conversations about this with the chief medical officer and chief scientific advisor, because you're right that there is in any system a degree of an arbitrary line that has to be drawn. And what we've seen is essentially, if you try and make that line too squiggly, if you try to introduce too many, but if it's this situation, then do this, and if it's that, then do that, people then get confused by the rules, and actually, with the best will in the world, some people may just not understand which rule they should be following under different circumstances. This simplifies all of that, and I understand what you're saying. My example is we're in a family of 5. There are 5 of us. If I want to see both my parents or both my wife's parents, we can't see them all together as 7 of us, indoors or outdoors, or in a restaurant or in a pub. And that is very, sad for us.
It's not just sad, Grant. It's stupid.
Than the spread of this disease.
Grant, it's stupid, because if you see your mother and then 2 hours later you see your father and they live in the same household, they could spread it to each other anyway. So therefore, you've introduced and you're backing and you are currently defending, as a government minister, a rule that you know right now. I know that you know it's a stupid rule. I know it's a stupid rule. Everyone listening knows it's a stupid rule.
No,
and yet the government is imposing this rule.
No, I don't agree.
It's not going to save any lives. You not seeing your mum and dad at the same time is not going to save a single life.
I don't agree, and here's why. We already discussed the way that people respond to rules as they get more complicated. And I bet a lot of people didn't realise that it was okay to have 6 people outside from different households, but you couldn't do that inside a restaurant, for example. It just got too complicated for people to be able to simply follow the rules. And so having a line in the sand where you say this is on the right side and this is on the wrong side. I know it's a little bit blunt, but it does make it easier to follow. Because it's easier to follow, it's easier for the authorities to interpret, it's easier for pubs and restaurants to interpret, it's easier for the police to interpret, and will actually therefore keep the virus down.
A lot of the police didn't seem to know what the rules were when they were very simple about the lockdown. So in terms of enforcing it, tell us the powers of these COVID marshals. What powers are they going to have? I'm assuming they're going to have clipboards and high-vis vests, so they're going to feel terribly important.
Well, they'll be able to remind people, for example, if they're about to go into a shop, that you need to be putting on a face covering.
Remind people? Are they able to enforce it?
No.
Why do we need reminding?
Because actually, we all need reminding of these things. I was out and about yesterday, and I was about to walk into a station. There was actually somebody there in a purple jacket. These are people we call journey makers. And actually, just having those people there, just visually seeing someone, just oh yeah, of course, we're living in different times. You put the face covering on, and I think that's a very useful reminder. In my area, well in Hatfield, we have people with street wardens. They're not police. They don't have those types of powers. But what they are very good at doing is reminding people, perhaps if things look like they might get a bit unruly, that there's people there who are able to provide people direction, keep a sense of order. Ultimately, the police are the people who have to enforce.
They won't have powers. They won't actually have any powers.
No, but the whole purpose of having this straightforward rule of 6 is if you break that rule, the police can ask you to be dispersed. The marshals could, of course, alert of a problem. They can fine, as you correctly said, and in the end, they could possibly arrest as well. But we very much hope we don't have to get.
Let's talk about Christmas Day. Lots of headlines are Christmas is cancelled. Prime Minister all very apologetic, but and again, I have to do this. I mean, he doesn't have to do this. There are always choices. But Christmas Day. So I've got brothers and sisters. I've got parents, step parents. They're kids. Quite a lot of us. Normally we'd have 12 to 14 people. If we went ahead and did that, we'd be breaking the law. We'd be fine. Realistically, unless you're going to be sending the police to every single person's household, how are you going to police that on Christmas Day? Do you expect people will actually ruin their family Christmases for this?
Well, first of all, we're not at Christmas yet. And I thought it was interesting, actually, when Chris Whitty was asked about the timing for this yesterday. He said, it's probably not 3 weeks that we need to have it in. It's longer. It hopefully won't be months and months, and Christmas is still a way away, and we'll have to see what we're able to do. And I suppose the hope is if we can all follow this and we can get the R number down below 1 again, then of course we'll be able to review the rules before Christmas, but we'll have to wait and see. And secondly, to answer your question, yes, it would be breaking the law. I'm afraid we've been here before. There was a point at which it was actually illegal to be outside your home for any one of our, apart from 4 reasons, and you'd be breaking the law in Britain in the 21st century if you were. But we all accepted that during the main part of the lockdown, and I think people will accept it here. We have policing by consent, don't we?
We do, but we were doing that because we were supposedly protecting the NHS, which could become overwhelmed. There's no evidence the NHS came close, even remotely close to being overwhelmed. We've got the Nightingale hospitals. There's no reason for us to go into lockdown to save the NHS. The NHS needs to be fully functioning. We need to be out and about.
So I think the thing about a virus, as we saw in the earlier days and as we went into the peak, is you get the doubling thing and then double, and it becomes a very, very fast growth rate and gets out of control. And that's how, let's not forget, at the height of things, hospital admissions were over nearly 3,500 people being admitted to hospital per day. If that had doubled again in a very short period of time, then we certainly would have required the spillover. We didn't, because we
provided it. We had the Nightingale Hospital to provide that, didn't we?
I suppose what I'm trying to say is in answer to your point, the difference between success and failure is the extent to which people follow the rules, and actually can be quite marginal. And therefore very important that people do follow the rules. Otherwise, you do get the doubling taking place.
All right, and our only hope for you not to have to choose between mum and dad and who you invite on Christmas Day, I don't know whether Mrs. Shapps gets a say in this or not, so we can have no more than 6 on Christmas Day, is this moonshot, we're told. This attempt to bring in some sort of very rapid test where presumably you cut out the laboratories and people have a test, they can get the results within 20 minutes. We've heard so many conversations over the last few months, 6 months onwards, about an antibody test that would be the game changer, the immunity passports, the antigen testing on a huge scale. Yes, we've upgraded our scaling of our testing, but we're looking at having millions of tests instead of 250,000 a day. This isn't a moonshot, is it? This is a long shot.
A moonshot, by its very definition, is something which is very difficult to achieve, but that we think is worthwhile. And you're right, completely level with you. There have been things during this coronavirus. There's no manual for tackling a global pandemic. There have been things which have worked well. There have been things that haven't. The things that have worked well have included getting 30,000 ventilators, mostly made in Britain, up from, I think we had about 7,000 at the beginning of this, building those 7 Nightingale hospitals in days, now being able to test 300,000 people a day, and we've got that going up to 500,000 with Charnwood and Newport coming online. So, and by the way, being the first country to discover treatment that actually works and saves lives in dexamethasone. So it's not like some of these things don't come off. And I think that we do have to be ambitious. It's not our only hope to save Christmas, though, just to slightly correct that point. Actually, we can save Christmas by absolutely following the rules of 6 that we've talked about today. And
the only way we're going to avoid a second full national lockdown, and BMA have got a leaked memo this morning saying the Prime Minister believes that is our only way of avoiding a second national lockdown before a vaccine, is having that capacity for 10 million tests. We've never reached any of the targets realistically in terms of the number of people testing so far.
I want to take you up on that. I remember very clearly when the Health Secretary said we would get to 100,000 tests, and everyone said, "Oh, it won't be possible." But guess what? We got to 100,000. We're now on 300,000.
That was for one day at that that moment. Look, there were some question marks about that, but getting to a few 100,000 is quite different from getting, say, 10 million tests a day.
Which is why it's a moonshot. You're absolutely right. It's
so
not
we're going to have a
second
lockdown.
Straightforward. But would you prefer that we didn't have ambitions to do this? That we didn't have plans?
Do you know what I would prefer? I think an awful lot of people. I love the fact we're looking at the vaccines. I love that. Yeah, we've got to do all of that. But I think what this country would prefer. People like me who've been very supportive of the government and supported the lockdown. I'm not a sceptic about it. I'm realistic. I think a lot of my listeners would feel what we really want is the government to just plod on with a lot of the really boring, dull stuff of getting a capacity up, getting those labs working so we can get people getting tested quickly and upscaling and doing perhaps the dull groundwork that does make a difference to saving lives rather than big gestures.
Yeah, look, you've got to do both is the simple answer. And the very dull, boring stuff is, as you say, making sure hands, face, space, getting those very, very important messages out there. You mentioned it already at the beginning of the interview. It's a bit dull. You might think it doesn't work. It absolutely does work. There's a brilliant video I saw from the NHS last night, which sort of shows how the virus is able to spread through the hands, face, space thing, or reinforces that message. Very dull, very boring, very, very, very important. And we do have to keep on with the day-by-day, drudgery of trying to beat this virus. I'm afraid the rule of six is part of that. But we also want to, lift our sights and do the big things. We've now contributed billions to the global effort to beat coronavirus, to the World Vaccine Alliance and the like. And, we have one of the, or at least two actually, of the leading vaccine.
Yeah, I'm very proud of our efforts on that front. We're going to have to leave it there because I know your team are going to be shouting at my team for me carrying you over far too long. But Grant Shapps, Transport Secretary, I do appreciate you joining us and answering all our questions and taking the time. Thank you very much indeed.